As a clinician, you should be aware of a type of patient that has a hypervigilant immune system. So, what you have to understand about the immune system, it's constantly developing throughout childhood and adolescence. And then you have some people that have this history of getting chronic ear infections, chronic upper respiratory infections, chronic GI infections. They've been on antibiotics for months and months and months throughout their childhood. They've been on steroids for various reasons, and they have this chronic history of dealing with these chronic immune infections throughout their adolescence. Well, they become adults, and many times as they become adults, they have this chronic hypervigilant immune response, and they walk into your office. These patients do exist out there, and one of the things you have to understand with them is they're a different patient. Once the immune system gets primed and hypervigilant during its immune development stage during childhood and adolescence, it's not going to calm down. Like, you're not going to give them a supplement or an herb to calm this down. And as a matter of fact, if you use supplementation with them, you're going to have to use very, very low doses because they react very aggressively to whatever kind of a immune supportive, immune enhancing support or different botanicals you're going to give them. Just know that these patients exist out there. Notice that they're unique. The rules you follow with other patients do not apply with them. They're an N of one. You have to figure out what their level of tolerance is. There's going to be a lot of trial and error with them. And if you know this, and then the patient knows this, this really creates the healthy environment for you to work with them. But you have to understand the difference in them and not label them as a weird or difficult patient, but they're very unique because they are this person who's developed a hypervigilant immune response, and now you have to work within those parameters to try to help address any chronic inflammatory condition they have. So these patients are out there, they exist, and just be aware of what's happened with them and their extreme sensitivity to different types of interventions. Always go very low dose.